Hey folks, we're back. Chapter 2 in the embalming book, Fundamentals of Embalming. This read kind of gets your feet wet with what it is we do in the prep room. So let's get started. There are definitions. I do not normally read definitions to you, so study these on your own. Okay, these would be important, very important to know. Just going to kind of scroll through. So let's look at embalming. An applied chemical process used to bring about the preservation and sanitizing of the dead human body. Preservation and embalming indicate indefinite perpetuity of the body, but realistically right now in modern or contemporary times, we only do a temporary preservation, allowing us time for religious services and funerals, and the body will eventually change its structure later. What our modern embalming does is it destroys protein reactive centers and an affinity to hold water, which results in a more stable tissue, but the lack of ability to hold water, which causes dryness. Conversion or inactivation of proteins of the tissues, proteins of enzymes, and proteins of microbes of the body is something else that happens as well. So basically, it stops enzymes from consuming things. It kills the protein in bacteria, which usually kills them outright, so that the things that would decompose or eat us are also then being killed by the solution we're injecting. And preservation can occur, of course, without chemical treatment. It can desiccate, complete absence of water, just dries right out. Well, problem is bodies do not maintain the recognizable condition they had in life when they die. The embalmed body should be in a condition of preservation that is not offensive to someone. You shouldn't swell it up, shouldn't dehydrate it, shouldn't be the wrong color. The embalmed body should have an acceptable appearance for friends and relatives who wish to view it. Germicides and preservatives effectively destroy enzymes and bacteria. The degree of preservation depends on a number of contacts made between the preservative chemical and with the proteins of the body and bacteria. So decomposition begins at the moment of death, and it's caused by enzymes, proteins that originate from body cells or bacteria. You have autolytic enzymes, the process of autolysis, not autolysis, autolysis, derived from body cells. The body's own cells are digesting the body. And bacterial enzymes, which derive from the bugs, the critters, bacteria. Embalming slows down the decomposition process, does not stop it. I've seen embalming retards the decomposition process, slows it down, arrests the decomposition process, but does not infinitely stop it. Okay, embalmed tissue, basically chemicals and protein combine to form a lattice work of inert materials that can no longer be easily broken down by bacterial or autolytic body enzymes. Indefinite preservation is not possible with consumer-grade standard embalming treatments. And the length of time a body will remain embalmed is dependent on two factors. Factors within the body called intrinsic factors. And there's some examples of intrinsic factors, and extrinsic factors, or things outside of the body. So climate, environment, insects, air, other bacteria, types of preservatives used. That's very important. So the magic question is, well, how long does the body stay embalmed? Well, it depends. Truly, it depends on a lot of factors. Science itself has no way of magically determining the length of time an embalmed body can be maintained. There's no finite formula we can do out and gives us the answer every single time. Restoration of the deceased to an acceptable appearance is also a goal of embalming or funeralization. We do not try to make the deceased look lifelike, but try to lessen devastation caused by pathogenic conditions. Nice way of saying this is we don't try to make the person look like they want to sit up and take a breath. People should still look natural in death. Injection of proper chemicals can restore facial tissues, restore moisture to the tissues, decrease facial swellings, remove post-mortem intravascular discoloration, and restore natural facial coloring. We do have different classifications of embalming, and the first one we're going to look at is vascular embalming. Use of blood vascular system of the body to accomplish the temporary preservation, sanitation, and restoration of the dead human body. Injection of embalming chemical solution directly into the arteries of the deceased and draining from the veins. Cavity embalming, direct treatment other than vascular injection of the contents of the body cavities and lumina of the hollow viscera. This is accomplished by use of a trocar in two phases, aspiration and injection. We have hypodermic embalming, which is the injection of embalming chemicals directly into the tissues of a dead human body through the use of a needle and a syringe or trocar. Generally, a supplemental technique. It's used when vascular embalming is unsuccessful or impossible. So we either do this after we've tried vascular, or if the body's in such a condition, we have to immediately go right to something like this, which happens in probably very advanced decomposition. We go in, we try to inject vascular, and it does not work, or in extreme burns, where the vasculature just simply is ineffectually burnt beyond any use, and we have to go in and treat everything this way. And the last classification, surface embalming, preservation of body tissues by direct contact with embalming chemicals, preservative gels or surface packs of cavity fluid. This is, again, a supplemental technique. It's used when vascular embalming is unsuccessful or impossible. Through the use of cavity and arterial embalming, complete preservation of the unautopsied body can be accomplished. Now, this number can be debated on multiple levels, okay? But the circulatory system typically contains 5 to 6 quarts of blood, or 8% of the body weight is blood. And there are 2 stages in the unautopsied body for embalming, arterial followed by cavity embalming. So arterial injection, known as capillary embalming, generally 3 to 4 gallons of a preservative solution is injected under pressure into the circulatory system of the deceased. Solution is made by taking concentrated preservative chemical and adding a vehicle solution, such as water. And we'll learn much more about vehicles and whatnot when we get later on into the book. The chemicals follow the same course blood followed in life. Arteries to capillaries to veins and then out. Capillary is the simplest division of the blood vascular system. The only difference is that blood does not pass through the heart. We'll see why when we get to those appropriate chapters. Solution travels to the ascending aorta, which then places pressure on the aortic semilunar valves, causing them to close. And once the valves close, the ascending aorta, arch of aorta, and entire aorta will fill with chemicals, and then it starts to distribute throughout the body. Once in the capillaries, the chemicals diffuse into the spaces, into the tissues, to link with proteins in the tissues and cells. Many organs are hollow. Their contents are not reached by this arterial preservative solution. So we have to go in with cavity embalming, which consists of aspiration, the removal of the contents of the hollow organs, as well as any other liquids or gas via the trocar from the abdomen and thorax, and injection, where once we take out as much of the stuff as we can, we put in a preservative chemical. And cavity fluid is a very concentrated fluid, and generally we use 2 to 3 bottles, 32 to 48 ounces. Each bottle is 16 ounces, so that gives you an idea of the 2 to 3 bottles. A good habit. Arterial injection should be allowed to set for 5 to 8 hours or overnight before cavity injection, if at all possible. In some bodies, even after the best of attempts, may require reaspiration and reinjection for sufficient preservation. And this is insurance against purge of gas or liquid coming from the nose or mouth, which generally families do not like. Subcuticular injection of a suitable preservative chemical directly into the tissues is a definition of hypodermic embalming. We use a syringe and needle, hypo and needle, or a trocar. We'll learn more about tools and instruments in a later chapter. Area of treatment may be localized or extensive. And it's only done when arterial chemical did not reach the site, or it is impossible because the vasculature is compromised or destroyed. Surface embalming, well, application of embalming chemicals directly to the surface of the skin or of the tissues is more appropriate because it doesn't necessarily have to be skin. You might have a body that's been autopsied and you have the flaps of the abdomen open and you are directly applying not the skin but the tissues. It can be applied in aerosol form in sprays. You can brush it on as gel, or you can use cotton with a proper chemical in the form of a compress. Can be applied on any surface of the body internally or externally. So inside of the neck, outside of the arms, scalp, whatever. There are plenty of places you can use these compresses. They're very effective. So embalming reports. One of these should be completed for each body regardless of preparation to assist in identification and tracking. Non-applicable sections should obviously not be filled out. So anybody that walks into your funeral home, you should take an embalming report and you should note the condition of the body. That way you have evidence that this was the condition when the body came in. You don't need to embalm it, just have a record of what the body looked like. The record could be very minimal with regards to preparation for an ID view. Family just wants to come in, view on a table, your funeral home permits that. You know, what did you do? I went ahead and I set features, I closed the eyes, I bathed the face, made things look presentable. It's very valuable when people try to say you did something or that wasn't the way they were at the hospital, because trauma is now evident. And these should be permanent in the file of the deceased. And in today's digital age, you should be able to keep these fairly easy in digital format for posterity so that you always have the evidence. And understand many states do have minimum record-keeping requirements, 5 years, 7 years, etc. Make sure you comply with those. The report should accurately describe body before your attempts at preparation, your manner and methods of preparing the body and preserving it, any post-embalming treatments you did to supplement the arterial and cavity injection, date and time of arrival of the individual, start and end times of embalming, name and license number of the embalmers, and name of any assistants who helped out. We'll study universal precautions more in another chapter, but universal precautions are always in effect. We consider every body infectious. And embalmers and assistants should always be in proper attire and protective gear or personal protective equipment. All bodies need to be identified prior to embalming, and that embalming case report should be completed with each body brought to you. An analysis needs to be made to select appropriate mouth closure, chemicals, injection sites, and whatnot. There's a whole chapter dedicated to analysis. That's chapter 10 in the 5th edition of Mayer's Embalming Theory and Practice book. So the unautopsied body timeline. This is a recommended set of instructions that, as your instructor will attest, will get the job done. I've adjusted some of the steps later to put them in a more logical sequence. So first thing, remove all clothing. Some funeral homes will launder the clothing and return it. Anything that is contaminated with biomedical waste falls under OSHA guidelines, okay? So you might have to destroy it. And if you are going to destroy it, make sure you disclaim that to the family because it is their property and they have a right to know what happened to it. Topically disinfect with a droplet spray or a disinfectant solution and give it time to work. The label will tell you how long it should sit to deactivate or destroy any bacteria on the external surfaces of the body. And the reason why I use a droplet spray is because the droplets are heavy. When you spray it, it will not dislodge things and blow them off the body and aerosol it. The water will hold it down and be more effective in destroying anything that needs to come in contact with. And disinfect everything, all orifices, eyes, ears, nose, mouth, genitalia, anus, axilla, armpits, all of it, okay? Remove any material from the mouth and throat. Get in there with some forceps and maybe some towel or cotton and swab things out. Try to get it as clean as possible so that the disinfectant is doing its job proper. You can also use something called a nasal aspirator to make your life a little bit more easy. And again, we will study tools shortly. Position your body the way it should be. Break rigor mortis if it needs to. And again, we will discuss rigor. A lot of these things are going to be things we go very much in depth with. Use proper positioning tools to place the body the way it should. You could use some strips to help straighten arthritic limbs, but do not cut tissue without permission when trying to extend arthritis or contractures. Wash the body using germicidal soap. Use warm water. And make sure you pay close attention to face and hands. Hair needs to be shampooed. You should clean fingernails. And all these things are easier now than later. Use a brush when doing fingernails. Use blunt objects. Embalming instruments, even if they are blunt, can usually have very fine points and can still bruise and tear things inadvertently. And use solvents to remove any surface discolorations. It's better for you, because skin does not grow back on deceased individuals, to use the proper chemical to remove something than trying to scrub the living snot out of it with a Brillo pad. And if there's any doubt whatsoever in your mind about shaving, do not shave. You can shave later. That's one of those things. You never know what they want, so if you do not know definitively what they want, do not shave. Close the mouth using sutures of barbs or wires. Remove fever blisters with a soft rag or gauze moistened with warm water. Straighten nostrils with cotton. Some embalmers apply light massage cream on hands and face. There's a variety of techniques you can do to keep the face moisturized prior to beginning arterial injection. Surface compresses of bleaching agents, phenol, formaldehyde can be placed on pathologic extravascular discolorations. Fancy way of saying disease-caused discolorations. And you'll learn better practices as we go along. Clean eyes and close using eye caps or cotton. Select your appropriate chemicals and then inject your solution. Monitor your injection. Make sure the fluid is getting where it needs to go. Make sure you're not pushing too hard or too fast. And then you might have to change techniques as necessary to maximize the ability of the solution to do its work. When you're done injecting, make a visual and palpable inspection to determine if all areas have received chemical. Check with your eyes and also feel. You want to make sure that the body feels preserved. It's going to get a little bit drier. The skin's going to lose elasticity. There's a lot of different ways to do things. If you have no experience in the prep room, it's why mortuary schools throughout the United States require you to complete and participate in embalming so that you start learning these techniques. And then when you are done those, you might want to supplement with hypodermic injection and surface preservation as necessary. So you can break out the hypodermic needle and trocars and start working with direct injection of preservative chemical. As you finished up, remove your arterial tubes, which are your injection tubes from injecting the chemical from the embalming machine. Remove your drainage instruments, which have allowed you to take blood and excess fluid out of the body. Tie off the vessels you've been using. You don't want those to leak after you're done. Dry everything very well. Make sure your sutures are nice and tight so that leaking is reduced. Use incision sealing powder to further reduce the possibility of leakage, and then use some type of adhesive or sealer over your sutured incisions to make sure that everything stays nice and dry. And do that after you're done the terminal bathing and disinfection of the body. It makes no sense to put adhesive or glue on there and then wash the body and potentially wash the glue off. We've already seen it's a best practice that once you're done injecting the body arterially to kind of let it set for 5 to 8 hours or overnight if possible. But if necessity demands, okay, or under certain circumstances where it is recommended to aspirate immediately, you begin to aspirate to empty the contents of the hollow viscera of the body. After that, inject the body with the proper cavity fluid and close the opening made by the trocar with a purse string suture or a trocar button. Trocar buttons are universally very popular with embalmers these days. And then remove any surgical drains, intravenous lines or IVs, catheters that enter the circulatory system. You'll see why we don't remove them prior down the pike. Pacemakers, if the body's to be cremated, make sure you have permission for that because that is something extra outside of the permission given when embalming a body. Ostomies, remove the ostomy bag and close the stoma. Disinfect the area very thoroughly. You will also disinfect the ostomy bag because that is proper protocol before disposing of it in your biomedical waste. And pack anal and vaginal orifices. Shampoo the hair, wash the body, check the mouth for any purge. You might need to, you'll see later on, pack the neck so that any purge gets caught before it comes out. And then flush the embalming machine. A very important thing is to flush your embalming machine. Embalming machines are made of metal. They might have silicone or rubber gaskets. So if you keep something like formaldehyde, which is a fixative agent, in there, what will inevitably happen is some of those things may harden quicker than they should, which then cause leakage and issues with your air monitoring in the prep room. So by flushing it, it keeps the machine well lubricated. One of my preferred things of doing is after I've adequately flushed my machine, I will put in a bottle of pre-injection solution to help keep things lubricated and run the mix for a little bit to make sure it gets everywhere. Disinfect your instruments. Dispose of all the waste in the appropriate containers, biomedical in your biomedical waste, general trash in your general trash. You will learn the distinctions between them. And finish your embalming report. So the same report you started with when the body walked in, you will indicate your chemicals, your injection methods, and everything that you did on that same report. Check several hours later, after aspiration, to see if you need to do it again. You might need to re-aspirate to get some fluid out. You may need to re-inject with cavity fluid. Dress the body in plastic garments as necessary, and the type of plastic garment matters. And then apply cosmetics. Okay, apply light cosmetics, or if necessity demands, a more rigorous opaque cosmetics. And with the autopsy body, the same rules apply in regards to protecting yourself as in the embalmer and your embalming analysis. You know, what do you see? How are you going to, what does that tell you of what you need to do? Try that technique, try that particular course of action, and then look at the result, and then continue on with the flow chart. What do you see? How do you respond to it? Do that and see what happens and keep on going. So, place autopsied body, center a prep table, spray with concentrated droplets, surface disinfectant, wash body with warm water, and a antibacterial germicidal liquid soap. Definitely try to get rid of as much blood as possible on the skin surface because blood will discolor the skin permanently. Okay, clean hands and fingernails most definitely. Make sure you have the proper solvent to get that nasty fingerprint ink off if it's come from the medical examiner or coroner's office. Rinse the hair. So important in a posted body to make sure that you are cleaning the hair probably several times. You want nothing left, no clotted blood, no bit of biological matter, because all of that will create odor and lead to very nasty things with your client families. If there are temporary sutures, many pathologists will give you a couple of bridge sutures or a very quick whip suture to hold things together for transport. Open them up. You'll need to aspirate any liquids that are inside the cavities. Spray inside the now exposed cavities of the body with your droplet spray again to help disinfect and protect you. See if there is rigor, relieve it if necessary. Examine the extent of the autopsy. There are several types of autopsies, and all of those may affect your embalming technique. Shave, again, make sure you have permission, and if you have any doubt, do not. Clean the oral cavity, set features. If the tongue has been removed, you want to pack tightly with cotton saturated in cavity fluid or autopsy gel so it begins preserving those internal tissues. You can insert it through the base of the neck or into the mouth. Generally, it's easy to pack up from the neck up. And this is going to help you later by basically stopping a lot of these severed arteries, the smaller arteries, from leaking because it hits the pressure and it kind of forces things down the pipe to the next item. It also gives you some type of idea of filling out the body that may be collapsed because of the missing deeper structures. Clean the area around the eyes, set eye features at this time. Prepare your arterial solution. We have whole chapters dedicated to what type of solutions to prepare, especially when it comes to autopsies. I believe that's chapter 15 or 16 in this book. And promise you we will study autopsies in detail later. Expose arteries that will be used for injection. Place injection tubes in them. Place drainage devices where they need to go. And during an autopsy, because there is no convenient way just for the fluid to come out onto the table and get rinsed, you do need to aspirate constantly. So you'll use something specific called an autopsy aspirator to continually drain the formaldehyde solution you are injecting, because that is a hazard to you as the embalmer. You can get very, very sick from inhaling formaldehyde fumes. Inject the legs first. Pay attention to distribution to ensure a uniform look. And the reason why you inject the legs first is because those are typically a non-visible area. And by injecting them, you can see how your solution reacts, what type of coloration you're getting, and make adjustments when you go up to the arms, which would be the next portion, okay? And then finally, you would inject the sides of the head, and by then you should have been able to fine-tune your solution to be very effective, or even change your solution completely to maximize coloration and preservation of the head. When you are injecting the arms, make sure you are getting distribution throughout the fingers. You may need to raise other arteries, such as the ones down near the wrist, okay, the radial and ulnar, that is in the distal part of the arm near the wrist. Then you inject the face, left side of the face first, then right. That does matter, so make sure you are doing that. Prepare a second, stronger solution in the embalming tank. Diluted cavity fluid. Be aware that most manufacturers these days will void your warranty if you use any cavity fluid in your machine, so stick with the high index arterial, but it would be okay to use diluted cavity fluid. Your book does, advertise that, so to speak. And then you need to hypodermically inject buttocks, trunk walls, shoulders, back of neck, and any area where distribution may not be sufficient because of the extent of the autopsy. And you would do this from inside the body. You would do this from inside the open cavity. That way, if there's any leakage, it pools on the inside of the body, not outside. And make sure that you also hypodermically inject That's what we're doing here basically, using a hypovalve trocar, infant trocar hooked up to your embalming machine under pressure. The skin flaps, the skin margins, so that you get preservation there as well. Typically, the severe trauma of the autopsy and the removal of many of the internal arteries of the abdomen and thorax will prevent sufficient fluid into getting to those skin margins. Aspirate any remaining fluid, dry the walls of the cavities, and then fill them. You can use absorbent sheeting, can apply preservative gel or cavity fluid to the sheeting. Once in place as an additional preservative consideration. I know a lot of places do that. Repack everything to make things look natural. So you might use K-Pock, cotton, preservative gel, mastic, anything to basically restore the form of the body. With the viscera, there are several theories of what to do with viscera. Can be placed in a biohazard bag and returned to the body. Put the bag in, then sew the flaps around it. Minimum of 2 bottles of cavity fluid should be poured over the viscera to help preserve it while you're doing your arterial preparation of the body. You will need to open any hollow organs, so you have to go in with a pair of sharp scissors, maybe a scalpel, and kind of open things up so that you have the ability to go ahead and make sure that you are getting adequate preservation of the interiors of those hollow organs. Suture everything shut. Use a baseball or locking stitch, or both is what it says. I strongly encourage you to use the baseball in every couple of stitches, every 5 or 6 stitches, every 3 or 4 inches. You do a locking stitch to kind of hold things in place so if something happens, you don't have to start over. Some people do nothing but locking stitches. It's whatever you prefer. Fill cranial cavity with absorbent material, and many autopsies, especially complete autopsies, they will evacuate the cranial cavity, so you will have to restore the head. You just pack some cotton in there with some gel. You might want to put in some absorbing material like whiting, K-Pock. Suture the scalp beginning on the right and ending on the left. Okay. Prior to that, anchor the calvaire, the top portion of the skull. You'll need to put the bone plate back in, and there's a variety of ways of doing that. We'll study them later in the course. A liberal amount of incision sealing powder should be used because you do not want leaking coming from the head. It will destroy pillow, destroy clothing, and generally make your families very upset. Then bathe the body, shampoo the hair, make sure you've gotten everything out, turn the body, dry the back, dry the back of the neck, make sure everything is just absolutely in the best condition you can make it. Apply surface sealer to the autopsy sutures, glue mouth and eyes down if you need to. I didn't have to do that too often, but only if there were issues keeping the mouth from closing properly or the eyelids from staying shut. I found it to be very rare in my practice. Most certainly, with an autopsied body, you will be using plastic garments. Recommendation is usually a unionol of some sort. Okay, and then apply cosmetics. Generally, a rule of thumb is when you do an autopsy, you almost never can get that perfect skin tone back. There's usually some type of graying effect with the formaldehyde because of the enhanced type of chemicals that we use when doing an autopsy. So it does require some type of cosmetic treatment more than, say, an unautopsied body, which you can have very excellent results just using the fluid dyes in a very minimal amount of cosmetic. Identification of the body is essential, okay? So use pictures. If you want people to be able to identify their loved one, you might use a closed-circuit TV where you show it to them on a monitor somewhere. You can even do direct confrontation. You can bring them into the room, you can pull back the blinds, whatever. But make sure you get written permission for picture or CCTV, because you have some issues there with taking the picture of the body and holding that. You want the family to know that you're doing it and giving permission for that. And document all those confirmations, most certainly in writing. Do not rely on oral representations. You want it in writing. The embalming report, of course, should note the physical condition of the body before and the physical condition of body afterwards. If they're just coming in to identify the body, there is no preservation, then you most certainly want to document the condition of the body as it came to your funeral home, and that should be the condition of the body as they view it. And in many states, refrigeration is a necessity. In the state of Florida, for instance, outside of purposes of funeralization or transport, remains must be placed under refrigeration within 24 hours. They may be taken out only for the purposes of transport or funeralization or disposal, or must be returned within 24 hours to the refrigeration. When storing bodies or using are doing an identification for a body, you always want to position the head and shoulders above the body to lessen blood discoloration. By putting the shoulders and head up, the blood will basically gravitate. Gravity will pull the fluid down and into the chest, where it generally can be much more well hidden under clothing rather than discoloring the face. If you can, you should get a permission to cavity embalm the body only, no arterial. Just use the trocar to aspirate and then inject cavity fluid. There is a possibility that embalming may be performed. Do not cavity embalm, because if you go in there with the trocar poking holes in all your major arteries, you're going to be able to build nothing and distribution will be shot. So if they're coming in to make a determination whether to view or not, you might want to go ahead and not suggest something like this. If they just want to come in or whatever and there's no possibility, then you might get away with a little bit of cavity embalming, but you do need permission for that. Shave if you need to. Okay, shave if you have permission to shave the body. If you do that with your ID views. Removal of any devices such as pacemakers should not be done until you have the written authorization. So until they sign the cremation authorization, which should have a clause built in for removal and disposal of your electronic devices, battery-operated devices, you should not be doing things like that. So suggested procedure for the ID view, the unembalmed ID view: disinfect the body bag container and open or unwrap the body. Report conditions of remains. Note any medical attachments, catheters, IVs, bandages, pacemakers, anything like that. Do not remove any ID. That's the general rule, even when embalming. If you don't have to remove the ID, don't do it. You might be able to hide it under a shirt or something. That way there is never a doubt. If you do take something off, make sure you place it in the permanent file. Many states require you to place your own identification on the body at time of transport. And if it's not done at time of transport, then as soon as it gets to the funeral home. So make sure you are placing your own ID for chain of custody purposes. Remove all properties. Place it in a labeled container, store in a secure place, company safe, whatever your protocols are. Disinfect and pack all orifices, anal, vaginal, including throat if necessary. Disinfect the body surface. Remove any medical devices and other large tubing. But do not remove circulatory invasive devices like IVs. One, because if they do decide to embalm, you're now going to suffer something called a blowout, which you will study. And if you've obtained the appropriate permissions, do your cavity aspiration, injection, removal of pacemakers, whatever. Bathe and shampoo remains. Clean hair and nails. Do not trim nails unless permission is given. Understand, by trimming a fingernail, you are committing the tort, the civil crime of mutilation. You have altered the condition of the body from the condition you received it. Generally, cleaning the body is not a change of physical condition, but definitely cutting the body, trimming it permanently, that is going to be an issue. And bathing and shampooing is usually a good idea. That way it removes odors. And you can build this into your price structure. Several ways you can do it. Or just, build it into your basic services fee so that every family pays for it every single time, no matter what. That way you are providing a high level of service. Close mouth and shave if permission has been given. Apply massage cream or a humectant like Restorative if massage cream is unavailable. Restorative is a humectant chemical manufactured by the Dodge Chemical Company. I have not had the opportunity to use other humectant chemicals in a similar fashion, but I have found that this works actually rather well for things like an ID view. You can just spray it on real quick. It doesn't seem oily. It dries to a very matte finish so that it reacts very well with air and cosmetics once it's dry, whereas massage cream, if you put too much on, you might have to wipe it off, whatever. But I've done both. I've done both. Use your preference. Play with them in your embalming labs if you have these chemicals available, and see which method you like the best. Tape, bandage, glue, or suture any leaking sites that you might need to, such as IV punctures, or maybe they injected, or during heroics they tried to inject adrenaline or something. Dress in plastic garments. Add the embalming powder inside the garment and cover in a clean gown. Place on a plastic sheet or inside of a body bag or over a cloth sheet. Place body on the plastic and cloth sheets and wrap remains. Basically, what you are doing is shrouding them so that the body is nice and secure, nice presentation. Secure arms and legs with ties around the plastic and sheeting using cloth strips. And do not tie around the neck because they will inadvertently think that you are choking their loved one. So keep things loose, for the most part, but secure it around the arms so the arms don't flap around. Secure it around the legs so the legs don't bounce around in case someone touches something. because an arm dropping off a table would most certainly freak someone out, and they'll probably injure themselves when they jump back. You just don't want that. Attach another ID tag and biohazard tag if body is not embalmed. So once you have secured the body in the shroud, you are essentially attaching a ID to the shroud so that you can easily check the identification. And if you place another pouch, label the pouch or container. Rule of thumb is anything a body is in or contained in should have an ID. So if you have the body itself, it should have ID on the wrist or ankle or wherever you would normally put IDs. Once you shroud it, you have an ID on the shroud according to the book. If you then take the shrouded body and put it into an alternative container for cremation, there should be an ID on the alternative container. You can never have enough ID is what it comes down to. So under extreme conditions, some preparation of the body should be recommended to the family to control odors and appearance. So extreme decomposition, found in a lake after several days, victim of extensive burn injuries. And the recommendation is place in a Union-All and add embalming powder. Wrap the head in gauze to hide damaged tissues if possible. Remove only after informed consent and written waiver. So just don't go in there with a scalpel or anything trying to excise tissue without the proper permission is what that comes down to. If you're asked to dress the body, place it in a Union-All first. Obviously, the body is probably going to be fairly messy and it will destroy the clothing. If the family wants that clothing back, that could be problematic for you. If it's not possible to address, explain it to the family. You know, that's part of the hard part of our job is sometimes we have to do some really crappy things. And explaining to people, you know, the situation of things is part of that fun. And I would most certainly preface a statement like that, folks, with something along the lines of, you know, I cannot really explain this in any other way but the way it is. So I'm going to have to use some pretty scientific and some type of terms that people may find offensive. So, you know, if we proceed, I need to explain to you what it is that you will experience. And obviously, if it's one of those situations, you will document it in writing. You want to get a waiver before they walk in and say you didn't explain it adequately. And whatever you have said, you know, grotesque or whatever, is what you actually need to write. So you should basically read it off the paper to them before they sign it. So, folks, thank you for your attention. We will see you next time.